Hi friends, good evening and welcome to my channel. Friends, today we are seeing some questions from care of the newborn. First question we can see. First question, a nurse in a delivery room is assessing with the delivery of a newborn. After delivery, the nurse prepared to prevent heat loss in the newborn resulting from evaporation by. Options are option A, warming the crib pad, option B, closing the doors to the room, option C, drying the infant with a warm blanket, and option D, turning on the overhead radiant warmer. Here, this is our question and options. So, usually after delivery, immediately after delivery, the baby should adjust with the new environment. Okay, so the baby should be in a coming from the wet surface. Usually evaporation will occurs in the baby's body. So evaporation of moist from the wet baby vanish heat along with moisture. So heat and moisture will remove from the body due to evaporation. So as a nurse, what we should do is keep the baby dry. Okay, we should keep the baby dry by drying using some blanket. Okay, drying the infant with a warm blanket is correct over here. So immediately after delivery we should dry the baby and to prevent hypothermia also. So once the evaporation occur, if the baby is not adjusting with the environment, there is a temperature loss will occur in the body that will lead to hypothermia. So in order to prevent all those things, we should cover the baby with warm blanket. Okay, so option C is the correct answer. Drying the infant with a warm blanket. Second question. A nurse is assessing a newborn who was born to a mother who is addicted to drugs. Which assessment findings would the nurse expect to note during the assessment of this newborn? Options are option A, lethargy, option B, sleepiness, option C, infant crying, option D, curls when being held. Here we will see, this is our questions. We can see the answer. A nurse is assessing a newborn of a drug addicted mother. So what assessment findings she can expect during the newborn assessment? That is the question. So a newborn of a woman using drug is always irritable. When a mother is using drug, the newborn will be always irritable. Always irritable means the baby will be crying always. That is option C. Infant crying is the correct answer over here. So why means the infant is already overloaded easily by sensory stimulations due to the drug effect. Okay, so this stimulation baby will feel irritable and the baby started to crying always. That is option C, infant crying is correct over here. Third question, a nurse in a newborn nursery receives a telephone call to prepare for the admission of a 43-week gestation newborn with ABGA score of 1 and 4. In the planning of admission of this newborn, the nurse's highest priority should be option A, turn on the apnea and cardiorespiratory monitor, option B, connect the resuscitation bag to the oxygen outlet, option C, set up the intravenous line with 5% dextrose in water, and option D, set the radiant warmer control temperature at 36.5 degrees Celsius or 97.6 degrees Fahrenheit. Here a nurse receives a phone call to an admission of 43 weeks gestation newborn with ABGA score. We have to note the ABGA score. ABGA score is between 1 and 4. Okay, so the normal ABGA score is 8 to 10. So if it is normal means no need to prepare any extra preparation for the admission. Here ABGA score is very low, that is 1 to 4. So what the nurse is the nurse highest priority should be. So here as a nurse, the highest priority on the admission to the nursery For a newborn with a low Apgar score is the airway. Airway is the highest priority. So which would be involved? Preparing respiratory resuscitation equipments and oxygen. So here option B will come correct. Connect the resuscitation bag to the oxygen outlet. So in order to maintain the airway, she should maintain a resuscitation bag and oxygen outlet to the baby. She should prepare it. Okay, remaining option: turn on the apnea and cardiorespiratory monitor and set up the intravenous line with the 5% dextrose in water and the radiant warmer control temperature at 36.5 degrees Celsius. This is also an important over here. This will come next to that. Okay, resuscitation bag and oxygen outlet, that is also important, but highest priority for airway should give. Okay, so option B is correct over here. Fourth question, a nurse is assessing a newborn infant after circumcision and note that the circumscribed area is red with a small amount of bloody drainage. Which of the following nursing action is appropriate? Here we have to note the circumscribed area is red with small amount of bloody discharge, that we have to note over here. Options are: contact the physician, option B apply gentle pressure, option C reinforce the dressing, option D documents the finding. So what is circumcision means? It is a surgical removal of foreskin that over the tip of the penis, that is circumcision. After circumcision, the nurse note that there is red with small amount of discharge over the area. So if it is small amount of discharge is the normal things after the circumcision. The penis is normally red during the healing process after circumcision, and also yellow exudate may be noted in the first 24 hours. Here the small amount of bloody discharge is a normal process, so nurse should not take any action over here. Just she should notify this in a record, that is document the finding. Option D is the correct answer. If another options we can see, if it is massive bleeding, that is if the bleeding is more, then what she should do is apply gentle pressure over the area with a gauze piece, sterile gauze piece. It will prevent the bleeding, and also after, if bleeding is not stopped, then she should inform the physician. So here our question is, the area is red with small amount of bloody drainage. So the nurse should not take any special action, just she should understand that it is a normal thing, so she should document the finding. Option D is correct. Fifth question, a nurse in a newborn nursery is monitoring a preterm newborn for respiratory distress syndrome. Which assessment sign noted the newborn would alert the nurse to the possibility of this syndrome? Options are tachypnea and retraction, option B echocyanosis and grunting, option C hypotension bradycardia, option D presence of barrel chest with echocyanosis. Here a nurse is taking care of a preterm baby newborn for respiratory distress syndrome. So which assessment sign is noted in the newborn would alert nurse to possibility for the syndrome? As a nurse, she should know what are the signs and symptoms can occur in a preterm baby with respiratory syndrome. The possible signs and symptoms of respiratory distress syndromes include cyanosis, tachypnea or apnea. Tachypnea means decreased respiratory rate, or apnea or absence of breathing, nasal flaring, chest wall retraction or audible grunting can occur to the patient. So clear cut it is given over here, tachypnea and retraction, that is tachypnea and chest wall retraction can occur a preterm baby with respiratory distress syndrome. Option A is the correct answer, tachypnea and retraction. Here, so the signs and symptoms she should note for the patient. Remaining options are, that is echocyanosis and grunting, hypotension, bradycardia, presence of barrel chest with echocyanosis. This is not coming over here. A new word, acrocyanosis, means acrocyanosis is a bluish discoloration of the hands and feet is associated with immature peripheral circulation. That is acrocyanosis it is a bluish discoloration of the hands and feet, that is echocynosis. So here our question answer is A.